I'm Sarah and welcome to my channel, The Spoony Life and Beyond. So today we are going to be going in and doing a deep dive into lupus. So I'm going to jump into that shortly, but first I'd like to let you know that I am not a medical practitioner. So anything that is said today in our deep dive is not intended as medical advice. It is just intended as awareness purposes. Also letting you know that I am vision impaired, so I may not always be looking at the camera, and I may also pause and get lost a little bit sometimes from the voice to text, the text to voice program that assists me. So I will start by jumping in. Sorry, just having some technical issues. There we go. Okay, so what is lupus? So lupus is a disease that occurs when your body's immune system attacks your own tissues and organs. So it's essentially, it's an autoimmune disease. So inflammation caused by lupus can affect many different systems within the body, so including your joints, your skin, your kidneys, blood cells, your brain, heart and lungs. It really doesn't discriminate as to what it's going to attack. So lupus can be difficult to diagnose because its signs and symptoms often mimic those of other ailments. The most distinctive sign of lupus is a facial rash that resembles the wings of a butterfly unfolding across both cheeks, which I do get. And it occurs in many cases of lupus, but not all cases of lupus. So this rash they usually call it a malar rash or the butterfly rash. So you may hear of it in both ways. So some people are born with a tendency towards developing lupus, which may be triggered by infections or certain drugs or even sunlight. So for myself, because I have lupus, I can't go out in the sun. I'm UV sensitive. So it'll actually cause a flare-up, and it's not a very nice one. So while there's no cures for lupus, treatments can help control the symptoms. So in going into that, there's no two cases of lupus that are exactly alike. So signs and symptoms may come on suddenly or develop slowly. It may be mild or quite severe, and it may be temporary or permanent. So with lupus, you can, have times where it does settle down, and then you can have flare-ups, and there can be long times in between, or there could be very short, limited times between flare-ups. So most people with lupus may have mild disease characterized by episodes, like I said, which are referred to as flares, when signs and symptoms get worse for a while, but then they improve or even disappear completely for a while. So you may get a break from it for a while and kind of almost go into like a remission. So the signs and symptoms of lupus that you experience will depend on which body systems are affected by the disease. So the most common signs and symptoms include fatigue, fevers, joint pains, stiffness, swelling, as mentioned before, the butterfly or malar rash on the face, which covers the cheeks and bridge of the nose, or you can get rashes elsewhere on the body. You can get skin lesions that appear or worsen with sun exposure. So as I mentioned before, being UV sensitive, it's almost like being allergic to the sun. Fingers and toes that turn white or blue when exposed to cold or during stressful periods, which can also be called Raynaud's phenomenon. Shortness of breath, chest pain, dry eyes, headaches, confusion, memory loss. So there's also as we've got into with the rashes, you know, it's generally a good idea if you've got unexplained ongoing fevers, persistent aching and fatigue, especially if you have been diagnosed with lupus, to go and get checked by your medical professional just in case, just to make sure everything's okay. They can run some tests, etc. Because lupus flares can also come out of nowhere. So as an autoimmune disease, lupus basically they think it results from a combination of genetics and your environment. So it appears to be that people with an inherited predisposition for lupus may develop the disease when they come into contact with somebody in the environment, come in contact with something in the environment that can trigger lupus. So the cause of lupus in most cases, however, is unknown. So some potential triggers can include, as mentioned before, sunlight. So exposure to the sun may bring on lupus skin lesions or trigger an internal response in susceptible people. Infections. So having an infection can initiate lupus or cause a relapse in some people. So myself, if I get a cold, for example, right now I've got COVID and my lupus flare has just started, which I know happens every time. If I get a major injury or anything like that, as soon as I get a immune response to anything, I end up getting a flare up. So even some medications. So lupus can be triggered by certain types of blood pressure medications, anti-seizure medications, and antibiotics. So people who have drug-induced lupus usually get better when they stop taking the medication. Rarely symptoms may persist after the drug is stopped. So some risk factors that may increase the risk of lupus is your sex. So lupus is more common in women. Age. So although lupus affects people of all ages, it most often is diagnosed between the ages of 15 and 45. And according to the Mayo Clinic, with race, lupus is more common in African Americans, Hispanic and Asian Americans. So some complications with lupus is inflammation that can affect many areas of your body. So that includes your kidneys, your kidneys. So kidney damage, kidney failure is one of the leading causes, unfortunately, of death among people with lupus. So there's brain and central nervous system. So if your brain is affected by lupus, you may experience headaches, dizziness, behavior changes, vision problems, even strokes or seizures. Many people with lupus experience memory problems and may have difficulty expressing their thoughts. So there are also the blood and blood vessels. So lupus may lead to blood problems, including a reduced number of healthy red blood cells or anemia, and increased risk of bleeding or blood clotting. It can also cause inflammation of the blood vessels. So then it comes down to the lungs. So having lupus increases your chances of developing an inflammation of the chest cavity lining, which can make breathing painful. Bleeding into the lungs and pneumonia is also possible. So there's the heart. So with lupus, it can cause inflammation of your heart muscles, the arteries, or the heart membrane. The risk of cardiovascular disease and heart attacks increase greatly as well. So one common thing when it comes to the heart or the surrounding tissue of the heart with lupus is pericarditis. So that's like the swelling around the lining of the heart, and they can generally tell. So if you go into the hospital with heart pain, and they can listen to your chest as you breathe, they can actually hear like a rubbing sound, and that's the inflammation from around the heart. So rubbing as your heart beats, and they can also tell by an echocardiogram as well. So there's other types of complications. So having lupus also increase your risk of infection. So people with lupus are more vulnerable to infection because both the disease and its treatments can weaken the immune system. Having lupus appears to increase your chances of cancer. However, that is a small chance. So there's also issues with osteoporosis and osteoarthritis and your bones weakening. And then there's also, unfortunately, with lupus, there is complications with pregnancy. So either falling pregnant or being able to maintain or keep that pregnancy. So there is also that as well. So if you have anything that you would like to add, if you've got your own experiences as somebody who has lupus or is caring for somebody with lupus or has any questions, please do pop down your questions or comments in the comment section. If you'd like to share your journey or be a guest speaker, please do send me a message. It would be absolutely lovely to talk to you. So that is really the talk for today on lupus. The next talk on Monday, the next deep dive on Monday, will be going into rheumatoid arthritis. So also, if there is anything you would like me to do a deep dive on, please feel free to send me a message. I would absolutely happily be able to add that onto the list as well with the other requested deep dives, so we can go into that as well, because we're all for raising awareness when it comes to chronic illness, disability and invisible illnesses and disabilities, and also what it's like as a support person or a carer for the warriors going through this. So I really like to thank you for your time today and coming on and listening. And if you could please, as I ask each time, like, share and subscribe. And I shall see you on Monday with our next deep dive for rheumatoid arthritis. Bye.